Gentlemen, if you are over 60 and something has quietly changed during your most intimate moments, if the sensation is still there, the pleasure still arrives, but when it's over, you notice that nothing came out. This video was made specifically for you. Maybe it happened once and you told yourself it was a fluke. Maybe it's been happening for months and you haven't said a word to anyone. Not your doctor, not your wife, not your closest friend. You carried it alone because the shame felt heavier than the confusion. I want you to know right now that I understand exactly what that silence feels like, and you are not going to carry it any further today. I'm Dr. Bora, a men's health specialist, and what I'm about to tell you is this. What happened to your body is not the end of your sex life. It is not proof that you are broken, but it is absolutely a message your body is sending you that you cannot afford to ignore. Stay with me, because in the next few minutes, you will know precisely what is causing this, which of these causes is dangerous, and what modern medicine can actually do to fix it. 2. You're not alone. The numbers that prove it. Here is the first thing I want you to understand. Millions of American men over the age of 60 have experienced exactly what you are going through, and the overwhelming majority of them never reported it to a single doctor. Not because it wasn't serious, but because no one gave them permission to talk about it. The silence around this condition is far more dangerous than the condition itself, because silence delays diagnosis, and delayed diagnosis is what turns manageable problems into serious ones. You are already doing the most important thing a man in your position can do, which is seeking information instead of hiding from it. That alone puts you ahead of most men your age. Now, before we talk about what is going wrong, we need to spend a moment on how the system is supposed to work, because understanding the machine makes it much easier to understand why the machine breaks down. 3. How your body is built to work. Normal physiology. Your reproductive system is one of the most precisely coordinated mechanisms in the human body. The testicles produce sperm. The seminal vesicles contribute the majority of the nourishing fluid. The prostate adds its own protective secretion. And all of it is assembled in the urethra, ready to be expelled through a series of powerful rhythmic muscle contractions at the moment of climax. What most men never realize is that climax and ejaculation, while they almost always happen at the same time, are actually two completely separate processes controlled by two completely separate systems. Climax is a neurological event, a signal fired by the brain that produces the sensation of intense pleasure. Ejaculation is a mechanical event, the physical act of the muscles contracting and fluid being propelled outward. One system can function perfectly while the other one fails. Your ability to feel pleasure is governed by your brain and your nerves, and that system can remain entirely intact even when the mechanical side breaks down. This distinction is the single most important thing you will hear today, because it means the change in your body is not a failure of who you are as a man. It is a malfunction in one specific part of a very complex machine, and every malfunction has a cause. 4. What is dry ejaculation? Naming the condition. What you are experiencing has a clinical name, dry ejaculation. It is defined as reaching climax with the full sensation of orgasm, but with little or no semen being released. Many of the men who sit across from me in my office describe it as an empty orgasm, and that phrase captures both the physical reality and the emotional weight of the experience perfectly. I want to be direct with you about what dry ejaculation is not. It is not impotence. It is not the loss of desire. It is not the end of your ability to be intimate with your partner. It is a specific disruption in the mechanical side of the ejaculatory process, and it has specific causes. There are 4 primary reasons this happens to men in your age group, and the cause you are dealing with determines exactly what the right solution looks like. Let's go through each one, starting with the most common. 5. Cause number 1. The valve that stops working. Retrograde ejaculation. Imagine a one-way door located at the base of your bladder. Under normal conditions, the moment climax begins, that door slams shut, sealing the path to the bladder so that all of the semen has only one direction to travel, which is forward and out. In retrograde ejaculation, that door fails to close. The fluid follows the path of least resistance, flows backward into the bladder, and the result is a climax that feels completely normal but produces nothing. One of the clearest clues that this is what's happening to you is noticing that your urine appears cloudy immediately after sex, because the semen has mixed directly into it. In the United States, the 3 most common triggers of this condition are prostate surgery for benign enlargement, which is one of the most frequently performed urological procedures in men over 60, certain blood pressure medications, and psychiatric medications that relax the muscles controlling that valve, and nerve damage caused by long-standing diabetes, which affects over 40 million Americans. I had a patient, a retired contractor in his late 60s, who came to me 6 months after a successful prostate surgery, completely convinced that his intimate life was finished. He had stopped being close with his wife, he was withdrawn, and he was carrying a grief he couldn't name. When I explained that his pleasure system was untouched and that what had changed was purely mechanical, something visibly lifted from him. He was treated with medication to strengthen the valve closure, and his confidence came back long before the treatment was even complete. Dry ejaculation caused by retrograde ejaculation is diagnosable with a simple urine test taken right after climax, and it is treatable. But sometimes the valve is working perfectly, and the problem lies somewhere else entirely. 6. Cause number 2. The blocked road, ductal obstruction. Think of the ejaculatory ducts as a highway connecting the seminal vesicles to the exit point. If that highway is blocked, it does not matter how much the body produces, because none of it is getting through. Ductal obstruction is less commonly discussed than retrograde ejaculation, but it is a significant cause of reduced or absent semen in older men. The blockages are typically caused by one of 3 things: scarring left behind by an old, untreated prostate infection, small calcified stones that form inside the ducts, similar to kidney stones, or cysts that develop and press against the passage over time. Men with this condition often notice the change gradually. The semen becomes thicker, the volume decreases over several months, and some men experience a dull pelvic ache or pressure during climax that they dismiss as nothing significant. Diagnosis typically requires a transrectal ultrasound, which is a routine and minimally invasive imaging procedure that allows your urologist to see the seminal vesicles and ducts clearly. The good news is that many of these obstructions respond well to treatment, either antibiotics when an underlying infection is the cause, or a minor outpatient procedure to clear the blocked passage and restore normal flow. When the ducts are clear and the valve is working, but the volume is still declining, we need to look at the fuel source itself. 7. Cause number 3, the hormone collapse, low testosterone, hypogonadism. After the age of 30, testosterone levels in men decline at a rate of roughly 1 to 2% every single year. By the time a man reaches his 60s, that cumulative loss can be substantial enough to qualify as a clinical deficiency, a condition called hypogonadism. Testosterone is not just the hormone of desire. It is the primary driver of the entire male reproductive system, including the activity of the seminal vesicles and the prostate, both of which are responsible for producing the fluid volume in semen. When testosterone drops significantly, those glands become less active, output decreases, and dry ejaculation can be the result. The progression is usually gradual. A man first notices less volume, then a reduction in desire, then less firm erections, and eventually a less intense orgasm experience. Outside of the bedroom, the signs are equally recognizable. Persistent fatigue, noticeable loss of muscle mass despite no change in activity level, and a flattening of mood that men almost universally chalk up to simply getting older. That assumption is one of the most common and most costly mistakes I see in my practice, because hypogonadism is a diagnosable medical condition and it is very treatable. A straightforward blood panel measuring total and free testosterone is all it takes to confirm it. If deficiency is confirmed, testosterone replacement therapy, administered under careful physician supervision, can restore not only semen production, but energy levels, libido, muscle function, and overall quality of life. Those first three causes all carry real, actionable solutions. But as your doctor, I would not be doing my job if I let you leave without telling you about the fourth possibility. 8. Red flag. When dry ejaculation means something serious. This is the part of the conversation that requires your full attention. In some cases, dry ejaculation is not a mechanical inconvenience or a hormonal imbalance. It is the body's way of signaling something far more serious. Prostate cancer, as it grows and expands, can physically compress the ejaculatory ducts and block the passage of semen entirely. Bladder cancer, located near the exit point, can cause the same obstruction. Progressive neurological diseases, including multiple sclerosis, Parkinson's disease, and advanced diabetic neuropathy, can silently erode the nerve communication between the brain and the reproductive system, producing this and other dysfunctions as early warning signs. There are 5 specific symptoms that, when they appear alongside dry ejaculation, mean you need to contact your doctor today, not next week. Blood in your urine or semen, pelvic or lower back pain that is new or worsening, a fever accompanied by urinary symptoms, numbness or loss of sensation in the genital area, and sudden onset of dry ejaculation with absolutely no identifiable cause. Any one of these is a signal that demands immediate evaluation. This is not a situation for watchful waiting. The men who do best are the ones who act early. Now, there is one more dimension of this condition that medicine alone cannot fully address. 9. The hidden wound, emotional and psychological impact. No conversation about dry ejaculation is complete without talking about what it does to a man on the inside. In my experience, the emotional damage this condition causes is often deeper and longer lasting than the physical symptom itself. Men in this culture are taught from an early age to associate their sexual function with their value, their strength, and their identity. When something changes in that department, the response is rarely to seek help. It is to withdraw. Men stop initiating intimacy with their partners out of fear of being seen as less than. They manufacture excuses, create distance, and quietly grieve something they feel too ashamed to name. That avoidance creates a cycle that is genuinely destructive, not just to a man's self-esteem, but to the relationship that likely matters most to him. I want to say this as plainly as I can. Your capacity for pleasure, for closeness, for genuine connection with another person, none of that is stored in the fluid your body produces. It lives in your presence, your desire, and your willingness to remain open. The single most powerful thing you can do for the emotional side of this condition is to name it out loud, once to your partner and once to your doctor. Both of those conversations are far less difficult than you are imagining them to be, and both of them begin the process of replacing shame with clarity. That clarity is what makes the action plan I'm about to give you actually work. 10. Your action plan. 5 steps starting today. The first step is to stop treating this as something to wait out. If dry ejaculation has appeared suddenly or recently, schedule an appointment with a urologist within the week, not when you get around to it. The second step is to take your chronic conditions seriously, specifically diabetes and hypertension, because these 2 conditions are the leading American drivers of the nerve and vascular damage that causes this problem. Tight, consistent management of both protects the systems we have been discussing today. The third step is to get the right laboratory work done. Ask your doctor for a testosterone panel covering both total and free testosterone, a urinalysis conducted immediately after climax, and a basic metabolic panel to assess your overall health picture. The fourth step is to break the silence with your partner, with your physician, or both. One honest conversation replaces months of unnecessary suffering. The fifth step is to make targeted lifestyle changes that directly support this system, including foods rich in zinc, which is foundational to testosterone production. Pelvic floor exercises, which strengthen the muscles responsible for ejaculatory control, and consistent quality sleep, which is when the majority of daily testosterone is produced and released. Every one of these steps connects directly to what we discussed today. I want to bring you back to where we started. A man over 60, lying awake, wondering what it means that something has changed, afraid to ask, afraid of the answer. That man now has the answer. What happened is a signal, not a sentence. It is your body communicating a specific disruption in a specific system, and that system can be evaluated, diagnosed, and in the vast majority of cases, meaningfully treated. I have watched men walk out of my office with a clear diagnosis and an action plan and transform completely, not just in the bedroom, but in their energy, their confidence, and the way they show up for the people they love. Your vitality is not measured by what your body expels. It is measured by your health, your presence, and your willingness to fight for the life you deserve to be living. Do not let shame write the next chapter of your story. You came here for the truth today, and that decision alone tells me you are exactly the kind of man who still has his best years ahead of him.